Hi, my name is Dr. Devi Shetty. COVID has exposed the soft underbelly of the global healthcare delivery system. COVID has proven beyond doubt how important healthcare is, how important healthcare professionals are to the society. Today, millions of people are alive only because of the dedication, passion, hard work, sacrifice of doctors, nurses, and medical technicians. COVID has proven that the foundation of healthcare delivery system is built on the doctors, nurses, and medical technicians. Policymakers across the world realize that the world today is extremely short of doctors, nurses, and medical technicians. India alone requires over 1 million doctors and over 2 million nurses. It is sad that all of you who are graduated from respected medical universities across the world worked extremely hard to become doctors, find it so difficult to cross the regulatory hurdles to practice your skill as doctors in our country. But believe me, regulatory hurdles are there for the medical professionals in India, across the world. India is not an exception. But you have a hope. You can appear for the exam, and good number of young doctors do pass in the first attempt. If you do not pass, make an attempt second time, third time, fourth time, fifth time. But never give up. It is worthwhile all the hard work to get the recognition by the medical council to be a doctor in India. I have a very simple and a very important advice for all of you who are already graduated and those who are going to be graduate soon. When you come back to India, the day you land in India after successfully getting your degree from your university outside India, please join any hospital, large hospital, well equipped, busy hospital, and join the hospital to work in the medical intensive care unit, not in the ward, not in the OPD. If you work in the medical ICU, every day, every hour, you will learn what medical science is. First of all, most patients coming to medical ICU have multiple diseases. Good number of them are diabetics, hypertensive, they had a history of heart problem or a brain stroke. One patient is sufficient to teach you most of the medical science, what has to teach you. And also, you keep on getting all types of reports, all types of images, all kinds of data. And going through those reports, understanding them, knowing the implications and the action to be taken will make you a perfect doctor. The amount of knowledge you will acquire in working as a physician assistant under a senior doctor is a lot more valuable than any of the coaching classes and the time you spent in the library. Trust me, today's examinations are all built on the foundation of problem-based education. You are given a clinical scenario and you are asked to take the decision on how to treat that particular patient. And medical ICU is the best place for you to learn the art of taking decisions and acting on it. Lot of young doctors, when they finish the graduation outside India, decide to come back and want to take 1 year off, sit at home and mug the multiple choice questions or spend their time in coaching classes. You will not learn medical science in the library or in the coaching class. You will learn it only in the medical ICU. When you come across a patient with sepsis, with multiple organ problems, you look at the knowledge you can acquire from that patient. Look at all the blood test reports, interpret it, understand what is going on inside the body and how you have to react. Believe me, this will be enough. This will offer you the best guidance to pass your exam. In a busy ICU, I want you to work only for 8 hours. After 8 hours, you go home. There are enough teaching materials available online. There are thousands of questions which were asked in the past in the exam, which you can go through, which is freely available to you. Believe me, it is not that your exam has an infinite number of questions. They are finite questions. They keep on getting repeated. And you can learn the answers of most of the questions in 6 months to 1 year period. But every day, 8 hours, you work in the hospital. More than the knowledge to pass the exam, it will make you a complete doctor. And you're designed by God to be a doctor. Otherwise, you wouldn't have gone all over the world to get the degree. God willing, you will pass the exam in the first attempt, second year, third year, fourth year. God forbid you didn't pass your exam even after fourth year of attempts, multiple attempts. But in 4 years, you have become a very, very, very experienced doctor who has so much of knowledge in the ICU, which is very, very rare in our country or across the world. There aren't that many people who have expertise to that level of managing a critically ill patient in the ICU as you will have if you spend few years in the medical ICU. And believe me, when you work as a physician assistant in a busy hospital under senior doctors, wealth of knowledge what you get is immense. This knowledge is a lot more precious than what you can get in any of the medical colleges or in a coaching class. Please pass on this message to all your friends, your classmates, your seniors, your juniors, and everyone. I would like all of them to come home, search for a physician's assistant job in busy ICU, learn the art of caring, healing in the medical ICU. Meanwhile, work very, very hard for the exam and you will be a very, very successful doctor. Good luck and God bless.